This is Pastor Recover, and I want to welcome you again in this episode 1, part B of family planning. And we are looking on family planning methods, so we proceed from there.
Is withdrawal method. On the withdrawal method, the male partner can withdraw the penis, before ejaculation. So while you are doing the sex, you feel that this time I'm reaching, I'm about to ejaculate. So that time is when you can remove the penis. So that one is a withdrawal method.
Okay.
Another one we have got lactation amenorrhea method. This method it involves the mother who is exclusively breastfeeding the baby and hasn't reached the 6 weeks. That is the from the date where the baby has born to 6 weeks, and is exclusively breastfeeding, is only breastfeed her baby. So that method can work properly. So breastfeeding exclusively for the first. I missed the point.
Yes.
For the 6 months, not 6 weeks. So for the
6
6
months.
months, yeah, for the 6 months. But he or she is supposed to exclusively breastfeeding the baby. Since the breastfeeding, it hinders the production of an ovum. So during breastfeeding, there is no ovulation, whereby we can say that the pregnant cannot come. Yeah, so that's about the traditional methods.
Yeah. So what are some different types of family planning?
Okay, so we have got various types of family planning method or the contraceptives.
Yes.
The number we have got the hormonal contraceptives. That one has got that one is a main group. There are some groups inside that hormonal contraceptive. We have got intrauterine device, IUCDs. On that one, we have got also two types concerning that. We have got barrier methods, we have got permanent methods, we have got images contraceptive. So in short, we have got 5 methods of contraceptive or the family planning. Okay. So on the hormonal contraceptives, we have got oral contraceptives, oral contraceptive pills. We have got injectables, we have got implants, we have got patches or vaginal rings.
Yes.
The first one on the oral contraceptive pills are taken daily to prevent ovulation, as I said. They are taken daily. It contains the hormones which prevent the ovulation. It contains the estrogen. So estrogen, once it is a high amount in the body, it causes the egg not to mature, or else it hinders the follicle stimulating hormone, which is the hormone responsible for the formation of an ovum. So the high level of estrogen in the body hinders the production of follicle stimulating hormone, hence acting as a contraceptive method. That one is oral contraceptive method, which I said it is taken daily. Another one, you have got injectable methods. Yes. On the injectable, we have got hormonal injection administered, which is can be administered each and every 3 months. We have got Depo-Provera and also Cyanopress. Cyanopress came during the COVID-19 for the mothers that they can inject them at their own home. While Depo-Provera is the same, but it is injected at the hospital. Can be injected. The woman can be injected and can wait for 3 months, then can come again to be injected. Another one, we have got the implants. Those are the small rods, like the matches sticks. So this can be put under the skin to release hormone each and every year. So as I said, there are others which are supposed to work for 5 years, which are the Jadels. There are others which are supposed to work for 4 years, which are Levoprans. There are others which are supposed to work for 3 years, which are what? Implanon. Those are the implants. They are inserted under the skin that release and they can release what? Hormones. Another one, we have got the patches and vaginal rings. Those are the rings which can be inserted to the vagina. and can release some hormones. But these, in our days, these are not common. But the most common hormonal contraceptive are the oral contraceptive, injectable, and the implants. That's about the hormone. Then on the IUCD, which is intrauterine devices, there are two types of them. There are copper IUCD, which are an hormonal device that prevent the sperm from fertilizing an egg. It is inserted in the uterus, so it will prevent the sperm to meet an egg. That one is copper IUCD, which is non-hormonal. We have got hormonal IUCD. These release hormones to inhibit ovulation and thicken cervical mucus, which means for the sperm to flow properly and meet the ovum, the mucus should be slippery, should be soft. So this one can make the cervical mucus to be thick. So once it is thick, it is hard for the sperm to flow and meet an egg. That's on the intrauterine device. There are two. Then on the barrier methods, we have got the condoms and the diaphragm. Yes. And on the condom, there is male condom and female condom. This one prevents the sperm from entering the uterus, or both of them, either the female condom or the male condom. Its main function is to prevent the sperm to enter into the uterus, hence protecting. And it also, the condoms, all the other methods can only prevent the pregnancy, but they cannot prevent the STIs, the sexual transmitted infection. But this method is very important, as they prevent the sexual transmitted infection. That is the condom. We have got also another one, diaphragm. But this one has phased out, doesn't work here in Malawi. Okay. But it was working. It is a dome-like shaped device which is placed in the vagina to block the sperm. But now this one is not has not been practiced. Another one, we have got the permanent method. On the permanent method, we have got the sterilization. On the sterilization, we have got the surgical. This is just a surgical procedure which is done either to the male or female. So in the male, for the female, we call it a tubal ligation. Tubal ligation for women, and for the men, we call as vasectomy. So these provide the permanent contraceptive. So once you are the woman or man has chosen to use this method, is permanent. The other methods is reversible. They can return to the treaty, but these methods cannot return to the treaty. And finally, we have got the images contraceptive methods. So these are the pills or IUCD. IUCD can also use as a contraceptive method, since it will prevent the fertilized egg to the uterus. But the danger is that they can cause ectopic pregnancies. Ectopic pregnancies, those are the pregnancies which occur in the fallopian tubes. Okay. So that's it. That's about the methods. And finally, we have got the traditional methods. Yes. Yeah. So on the traditional method, we have got the fertility awareness method, withdrawal method, lactation amenorrhea method, as I said on the past question.
Okay, you have said about sterilization. So what does sterilization involve?
The sterilization, this is the method which is done to the, can be done to the mother, can be done to the woman or female. In short, it is a surgical procedure designed for permanently prevent pregnancy. As I said, there are two. We have got female sterilization, and we have got male sterilization. It's a surgical procedure. So on the female sterilization, we have got the tubal ligation, and on the male sterilization, we have got the vasectomy. On the tubal ligation, this is a procedure which involves the blocking or sealing the fallopian tube. The fallopian tube, there is a formation of they make an incision, find the fallopian tube. Once they have found them, they tie and cut between the tubes. So this will.
Okay, so how effective are the different types of family planning?
The effectiveness of the family planning can vary, cannot be the same here. Can vary based on their types and usage. On the highly effective methods, that is less than one pregnant, there are 100 women. We have got the implants, we have got IUCD, we have got sterilization. That is, if we have got 100 women, only one woman can get pregnant among them. Even though they have done that one, we have got those methods: implant, IUCD, and the sterilization. On the moderate infect, that is, in terms of there is 6 to 12. There can be 6 to 12 women get pregnant among the 100 women. We have got the injectables, we have got oral contraceptives, we have got the punch. So it means that there are possibility. If we have got 100 women, the possibility of the women, even though they are on the contraceptive, is what is there are 6 to 12 pregnancies that can occur among them. And then on the least infective methods, that they can occur frequently. The more pregnancies can occur for the mothers or for the women or men which are using the contraceptive. We have got the male condoms, the female condoms, cervical caps, fertility awareness. We have got withdrawal. Yeah, so those ones, they are in terms of 118 or more pregnancies can occur for those women.
Okay, so what are the health benefits of oral contraceptive methods?
So on the oral contraceptive method, the benefits, there are many. There are many benefits. In terms of reproductive system, they relieve the heavy or painful irregular period, so the woman can, because once the woman is taking the pills, others cannot menstruate. So this one, the woman can have a rest, not doing the menstruating. It also acting as a treatment of menarche, which is the excess menstrual bleeding. The woman can have excessive menstrual bleeding. So once the woman is using all pills, can have reduced menses.
So what factors should women consider when choosing a contraceptive method?
The first one, the woman has to think about the effectiveness of the most. So the most effective method for long and reversible contraceptive, we have got IUCD implants, which are 99% the effective. We have got barrier methods, which are like the condom, the diaphragm, less effective with which has typical failure. So the effectiveness of a method, the woman has to think about that one. Another one, the reversibility or future fertility. If the woman wants to have a pregnant in the future, has to think about if he wants to get another pregnant in the future. So that's another one. Can also think of a method easy to use for him or her. They can think, they can think that this method is perfect. This method I can suit. So that's about it. And also on the health consideration,
yes,
the woman can also think about her health. Because if the woman is taking oral contraceptive or any method, and he is smoking or is at older age, it means it can have a lot of consequences.
Okay, so if a girl gets pregnant while she is using a hormonal contraceptive, will it harm her baby?
No, it can't harm the baby, because the hormonal methods are not related to the growth. In fact, once the woman is pregnant, once the woman is pregnant and she's still taking the contraceptive, there is no way or there is no problem for the baby who has started developing.
Okay, so the last question, how long will a girl takes to get a pregnancy after maybe she is using the pill or injection?
Immediately after using the injection, it can't take long. The pills can take few months In
Yes.
terms, maybe can be 2 or 3 months. For the injectables, maybe some can take 3 months, some can take. It depends on the body of the person, because women have got different body reaction to the drug. So it depends on the body of the woman.
Okay, fine. So to reach this far, this is the end of our discussion for today. So I thank you very much for joining us and give us stunning information like this one.
Thank you.
God bless you.
May the Lord bless you too.
Thanks.